Hello and welcome. This evening we've got a really exciting webinar which is part of a series on digital health connecting the dots. So we really wanted to welcome you from the Nursing in the Community of Interest, which is part of the Australian College of Nursing, and you can see there the Nursing in the Community Week, which is running from the 20th to the 26th of September, so starting next week. We'll go to the next slide, thank you. So in the spirit of reconciliation, the Australian College of Nursing acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So we would really like to thank our sponsors before we get started. So Regal, APNA, Medibank, and Smith & Nephew. And obviously without these sponsors, we can't bring the sort of work to you, along the way that we do. So we'd really like to extend our thanks to them. We're going to hear something now from our founding sponsor, which is Regal Health.
Hi, I'm Anna Shepherd, the co-founder of Regal Home Health. In 2015, I approached the Australian College of Nursing because I wanted to re-establish Nursing in the Community Week. So today in 2021, I'm very proud to say that we are in our 7th year of highlighting and profiling the very good work that nurses do in the community. But more importantly, that our public become aware of what the nurses can do to keep people at home, and that nurses find a career, a very fulfilling career for them in working in the community. What we're seeing now in 2021 is globally that people want to stay at home. It's more efficient, we're getting higher value care, teams are able to work more efficiently together, but more importantly, what matters to people, family and communities is that they can remain in their own home. So at Regal, for over 55 years, we've had a lot of experience in working in the community, but more importantly, experience in pandemic planning, which has seen us today with 100% of our workforce vaccinated, so that you don't need to worry about the nurse coming into your own home. So today, we're seeing the funding bodies, the regulators, the healthcare teams that we're working with are all working together for the benefit of our community. So Regal Home Health, the founding sponsor for Nursing in the Community Week, is very happy to be supported by Medibank Private and Smith & Nephew this year, and to be partnering with the Australian Primary Healthcare Nurses Association, all underpinned by the Australian College of Nursing. So this year, A Voice to Lead is our theme, and we're very much looking forward to sharing our insights throughout September. Thank you.
Thank you, and we'll now hear a word from our sponsor from Medibank. So just a bit of housekeeping today. The presentation will be recorded, and that means it'll be available to everyone on Neo on the Nursing in the Community of Interest. We do have a chat box, so I think your microphones have been muted, but just in case you have a burning question, and we hope you do, if you could please place it in the chat box just so that we can answer those questions towards the end of this afternoon. The moderator will then pose the questions raised to the panel, so we'll be able to see those. And of course, you'll receive a certificate that'll be emailed to you for your attendance here today. So firstly, I just wanted to, if we could just change slides. Thank you. Firstly, I just wanted to take you through our Nursing in the Community of Interest. So our chair is Kitty Hutchison. She's sitting in the background along with Deputy Chair Alan Merritt and the Communication Coordinator Pammy Allam. This group of individuals is doing an extraordinary role bringing together this community of interest, and so I'd really like to thank them, but also there's a little leadership position there that's free and vacant and ready for someone to jump in and assist, that being the secretariat role. So we will make sure that how you can apply for that role is posted in the chat for this evening, but we'd really like to encourage someone to jump in. It makes such a difference when you've got a full leadership for a community of interest. We'll go to the next page. Thank you. So nurses not only provide, but they also explain healthcare. So nurses working in the community are faced with new challenges and opportunities with the emergence of new digital technologies that allow care to be provided via new modalities. We're going to go through a lot of these this evening, and some of these are the expectations of patients and the community amidst increased digital literacy and access to health information. Telehealth, the use of technology is enabling new possibilities for care outside traditional healthcare facilities and capabilities to support the integration of digital health records in the community nursing practice. So it's going to be a really exciting presentation this evening, and I look forward to bringing it to you. So I'm Adjunct Associate Professor Naomi Dobroff. I'm a Fellow of the Australian College of Nursing, and I chair the Nursing Informatics Community of Interest. So when the Nursing in the Community of Interest reached out to me, I was very excited to be able to bring this group of amazing presenters to you this evening. So I'm the Chief Nursing and Midwifery Information Officer at Monash Health in Victoria, and I'm also an Adjunct Associate Professor with Deakin University. As I said, I chair the Nursing Informatics Community of Interest for the Australian College of Nursing, and I'm also a member of the Chief Nursing Informatics Officers Community of Interest, which I was a founding member of way back a whole 3 years ago. So lots of exciting things have happened in digital health in a very short period of time. So I want to introduce our first speaker to you this evening. Jenny Snowvanger is the Provider Adoption Lead for the Australian Digital Health Agency. Jenny is a registered pharmacist, a certified health informatician, and an educator at the Australian Digital Health Agency. She has professional experience working in primary care and also in the private hospital setting. So welcome, Jenny. We look forward to hearing about the Australian Digital Health Agency.
Hi everyone, thank you so much for having me join the session this evening. Very excited to be here, and definitely welcome any questions that you might have in terms of some of the digital health tools that the agency promotes, I suppose. So we'll start off with the first slide, if that's okay. Thank you. Most of you on the line obviously would know that at the moment digital health is definitely becoming more and more widely used. It's now becoming certainly sort of part of a scope of practice for nurses, as something that really assists your practice, helps you improve care delivery, depending on sort of the your area of practice, I suppose, whether it would be if you're a nurse in a hospital, in a community setting, or if you're someone practicing in a remote area, for example. So some of those key digital health tools that are playing a key role at the moment in the community are things like telehealth, for example. So most of you are probably very familiar with the term, but there are also other tools that can be used in conjunction with telehealth. So things, for example, as the My Health Record system, electronic prescribing, secure messaging. So these are probably the main sort of digital health tools that the agency helps support. So all of these can definitely be used to optimize the delivery of care, even if it does occur through that digital sort of telehealth medium. So on the next slide, I've just listed some of the benefits, I suppose, to using these tools in day-to-day practice. And basically, what they do is they allow for greater understanding and visibility of health information, increasing visibility of health information amongst different healthcare professionals, improving access to this vital health information when it is needed, and basically enhancing continuity of patient care. So even when healthcare providers are delivering health services through telehealth, how much information do they actually have available to them at that point? So how easy is it for you to gather information about a patient and make sort of, very informed clinical decisions about them? So all of these tools help improve that decision making, help improve coordination of care. And they do support your clients, your patients, and their carers as well. So it's very important that not only are these tools available for healthcare providers to use, but we also want to make sure that patients themselves and their carers also understand how these tools can be used to assist them. How do they assist them? How do they assist their healthcare providers that look after them? And also it's very important to make sure that they trust these systems and also take an interest in, having more control over their electronic health information. I'll get you to swap over to the next slide, please. So especially for those of you working in community settings, I definitely think that you have a very big role to play in this, in sort of raising awareness about digital health, raising awareness not only amongst your colleagues, your peers, but also most importantly, raising awareness amongst your own patients that you look after, their families, their communities, so that these tools can be embraced, can be used more often, and can be used confidently. Because that really helps with making sure that patients can keep track of their own health information, especially if they are, transferring between different healthcare settings. We really don't want them to have to retell their whole health story time and time again. We want you to have the time with the patient to provide healthcare services so that you don't have to waste any of that valuable time looking for information. So all of these tools really make that a bit easier for you to do. And on this slide, thank you. Basically, in order for these tools, these digital health tools, to continue to be adopted and implemented into our healthcare system, and so that you can also confidently explain to patients what these tools mean, how they can be utilized, we need to make sure that we have a workforce of practitioners with the right capabilities. So in October 2020, the National Nursing and Midwifery Digital Health Capability Framework was released. And this framework focuses on 5 different domains. It covers a range of different capabilities, and it's really intended to support health organizations, healthcare professionals as well, in identifying and assessing your capability levels, based on the framework, to help guide your professional development, your professional planning, because really at the end of the day, we want you to be the champions. We want you to champion the use of digital health technology in our community. So you can definitely find a bit more information about the framework on our website, and I definitely encourage you to have a look at that. On the next slide, I've also prepared some links that hopefully we can share with you. Otherwise, if you can follow the link at the bottom, which is our Digital Health Agency website, so digitalhealth.gov.au, and we do have information on there about training that we do provide. So I am a member of the adoption and education team at the agency, and we deliver all of these training sessions. If you are interested in upskilling yourself a little bit in how you can use some of these digital health technologies, whether it is you needing to know more about how to access the My Health Record system, how to upload information, or if you have started to receive questions from your patients about how they can access some of this information, how they can share information with their healthcare providers. We do offer a lot of different sessions, and I certainly encourage you to come along and have a listen. Some of them are very practical, others are really sort of, we even offer quite informal sort of Q&A sessions where you can come along and you can ask us your questions about how you can use some of these digital health tools in your workplaces, in your communities. So I hope this gives you a bit of a overview, I suppose, of what the agency does and what some of these digital health tools are that you can use. And I hope that you, contact us if you do need some more information, or if you are interested in getting a bit more training.
Fantastic.
Thanks for having me.
Oh, thanks, Jenny. Thank you so much for giving us that overview. Obviously, the Australian College of Nursing works very closely with the Australian Digital Health Agency, so jump in there. We know there's some amazing tools, and in fact, I'm going to hand over to our next presenter, who I think is going to also touch a bit on the National Nursing Midwifery Digital Health Capability Framework. But welcome, Rebecca. Rebecca Heeland is the Chief Nursing and Midwifery Information Officer for ACT Health. Rebecca works primarily as a nurse lead for the implementation of digital health record across the whole of the ACT public health system. And of course, I know her well through the Nursing and Midwifery Informatics Officers Community of Interest. Welcome, Rebecca.
Thank you so much, Naomi, and thanks so much, everybody, for having me here. And when I did join the Nursing Informatics Community of Interest, it did feel like finally I could speak to the people who are getting what I was talking about, because in the informatics world, sometimes it's all of us going to work with so many nurses and giving guidance in the digital space, but it's good to work in that community of interest to really evaluate. So in the ACT, across our entire public health system, we are implementing a digital health record, what many people know as an electronic medical record or an EMR. And we're in the midst of doing our build and working with all of our clinicians across the territory around how we're going to configure the digital health record for our needs. Just onto the next slide for me. So we are envisaging a key milestone for us would be around connecting your care. And that's both from our patients and families' point of view, but also from our clinical point of view. So we're really looking towards having one person, one record across our entire public health system in the ACT, and improving that person-centered care through digital innovation and making it easier for people to access their health information. So in the next slide, it just gives a quick visual around all of the systems we have across the ACT. We have a lot, they're very separated, they don't talk to each other. And we know now that patients never have one simple problem. They always are seeing multiple clinical teams and going across various clinical areas. And on the next slide, it just gives a visual of what it is that we're replacing. So we're really replacing the majority of the clinical system space that we're working in right now. So it will have a huge impact across our public health system across the whole territory. So on the next slide, it's just about our scope. And so this is where I think from the community nursing point of view, which is one of the most exciting parts, I think, about the implementation of our digital health record. In the ACT, our public health system is 3 hospitals. So we're tiny when you compare us to all the other jurisdictions, but we have 3 public hospitals. But part of the entire public health system is our community centres. So we have community centres in our suburbs that have both clinics that people come into, but also our community nurses who based there and go out and do home visits. And our digital health record will incorporate, of course, the tertiary hospitals, but also our community centres and the community nurses that do go home into the home. So when we have patients moving in and out of that tertiary hospital space, we know that community nursing is often seeing the patient before or after those home visit, that hospital stay, and it'll be really exciting for us to be able to have access to the information of what happens for those patients when they are in the hospital, and to be able to, you know, have that continuity of care between community and those tertiary spaces. So I think I'm really excited about the fact that we'll be able to implement this across the territory and have that one patient-centred record. And one of the ways that we're going to be able to do that and work with our community nurses to be much more agile than what they're able to be right now is through the use of an app called Rover. This is our Epic is the digital health record system that we're implementing, and this is their app. And what that means is that this device, which is a clinical work device, which is a mobile phone, has Android capabilities, and, you know, can work as the community nurse's phone as they have right now. But will also enable the nurses to have access to the full medical record of the patients on their phone, and to be able to see all that information and do basic data entry into the patient's record on the phone. So it'll mean you can enter in the patient's observations, do medication administration recording. Notes may be quite challenging, but, you know, I do like to write long text messages, so it is possible. You could start your note and pen it and save it for later. So this is going to change a lot the way that our community nurses in the ACT are able to work. Right now, they do have to work through a very paper-based and a little bit of electronic systems, and it's quite clunky and very time-consuming. So I think this is going to really change a lot the way that they will be able to work once we've got these out into the community. So I'm sorry to repeat Jenny's presentation also around the National Nursing Midwifery Digital Health Capability Framework, but just really wanted to mention this as our community of interest group with ACN were worked on this for quite a long time and were a real key part of the development with the agency and many other organisations to get this up and live last year. And it's been, you know, it's a great document that really is able to outline key areas that nurses can assess against them, as Jenny did outline. So on the next slide, it just gives a great visual around, it's a bit small, but yes, the different 5 domains. So that being digital professionalism, leadership and advocacy, data and information quality, information enabled care, and technology. And I think, you know, it doesn't matter in what area we're working in, and of course in the community sector, we are all moving towards using more technology and being more digitally savvy. And this just really helps on the next slide to show the different types of ways that you can assess your capability in these 5 key domains. So would strongly encourage you, as Jenny said, to go to the digitalhealth.gov.au website and have a look at more of that information. That's it from me. Thank you, Naomi.
Fantastic. Thanks, Rebecca. Thank you so much. And I think it's very exciting that your electronic medical record is going to be used in the community, and I cannot wait to hear more about that. So yeah, I'm ready and waiting to hear. So thank you.
Keep you updated.
Thank you. Shireen Malawi is here. She is the head of telehealth clinical governance at Medibank. Shireen joined Medibank in 2010 as a telephone triage nurse and was promoted to telehealth clinical leader and program specialist before taking on the clinical government leadership for telehealth. Prior to joining Medibank, she was an ICU and CCU registered nurse resource for various hospitals. Shireen, welcome, and we can't wait to hear more.
Thank you. It's such a pleasure to be here, and good afternoon, everyone. As a clinical governance business partner at Medibank, I'm here to present what Medibank has been doing in the telehealth space. Most people are aware that Medibank is one of the leaders in providing insurance, mainly health insurance, and you can see that in the gray and blue sections of the diagram. However, what a lot of people aren't aware of is that we also deliver health services, and that's what I'm here to speak to in the next few minutes. So you'll see in the next slide, our health services are divided further into telehealth and digital. We've got home care as well as integrated care and coordination. You would have seen at the beginning an example of a home care patient who is really happy with just receiving that care in the home. But the main focus that I'm going to be touching on today is going to be the telehealth and digital part of the business. And this includes nurse triage and GP triage, counseling and health support. So if we go to the next slide, you'll see a further breakdown of our telehealth and digital service delivery. It comprises of the triage, which includes 350 nurses as well as 43 GPs. In the last year, we've provided around 1.5 million calls received from the general public, as well as about 3,000 digital interactions via web chat. We've also supported the community in the mental health space with our around 400 mental health professionals via the digital mode, around 100,000 interactions in the last year, as well as about 500,000 phone calls as well. And finally, we have the health concierge services, or the health support services. And these are the services provided that help support and coordinate patient care for government and non-government organizations. So you'll see that, Medibank has managed approximately 2.5 million telehealth interactions last year in 2020. What you see here on this slide is that the different organizations for which we've provided the telehealth service. So we've been Australia's leading provider of telehealth for more than 2 decades. Through well-established services such as Health Direct, which services most of Australia, Nurse on Call, which services Victoria. That's in the triage space. You can also see in the counselling space the New South Wales Mental Health Line, 1-800-RESPECT, Beyond Blue, New South Wales Quit Line. Additionally, throughout 2020 and 2021, Medibank played a key role in supporting the federal and state governments to care for the rapidly changing health needs of the community during the COVID-19 pandemic. So Medibank's health services team has set up more than 10 COVID-19 related health services across 4 different state departments. Last year, we handled over 320,000 health interactions about COVID-19 with Australians. By leveraging our team of around 1,500 health professionals across Australia, the Medibank team delivered telephone and digital services from health advice to well-being, health services, contact tracing, and arranging in-home COVID testing. It's really worth shining a spotlight on nurses working in the community. I personally am proud to be using my nursing skills and qualities to help people across the community. My role in telehealth allows me to help people right across Australia, including regional and remote communities, or people who may be hesitant even to go see a health professional in person. I've worked in hospitals and in the community, and continue to find community nursing provides me with new challenges and fulfillment as a clinician. So that's a brief overview of what we do, and there's certainly so much opportunity for nurses to be plugged into community nursing, where whether it's in people's homes or over the phone or even digitally. So please feel free to direct your questions to me in the chat box afterwards. I'm happy to answer any questions you might have about how to make a difference in this field. Thanks for listening.
Oh, thanks, Shireen. That was just fantastic. I had no idea that Medibank actually provided all those services. So that is just extraordinary. That the triage itself, being a Victorian, I know a lot about Nurse on Call, and it's a really trusted service. So yeah, that's just amazing. So thank you very much. I look forward to seeing if we get any questions along the way. I'd now like to introduce Shem. We're just changing gears a bit, and hopefully you can see that as we progress through the agenda. But Shem's the founder of Goldilocks Suits. So it's a smart clothing for infants to provide confidence to new parents. And this is done by tracking infant wellbeing via smart clothing to provide the best chance for their wellbeing and safety. using algorithms to give parents the insights needed to understand the well-being and temperament of their infant, giving clinicians unbiased data to make informed decisions, and using neural networks to detect deterioration as soon as possible. Shem, I'm really excited to hear more about this.
Thanks, Naomi, and great to see everyone. Thanks for having me on. So I guess for me, digital health was really brought home a number of years ago, because my mum had 3 kids by the time her sister-in-law had her first kid. So she was quite an experienced mum, and she knew what she was doing, you would say, by the third one, perfected. Unfortunately, I was the second one, so still a few mistakes that I had to cope with. This was my aunt lived in New South Wales. We live in South Australia, and so we went and saw him when he was first born, and everything was great. Everything seemed to be going fine. Then we went back a year later, and he was about 12 months by this stage, and my mum was playing with him and was like, oh, he's a little bit floppy, he's not sitting up, he's 12 months, that seems a bit unusual. My kids were kind of sitting up by that stage. And my aunt kind of said, oh, I don't know, it's my first baby, seems fine, doesn't seem any issues. Ended up taking him to get checked, and he had cerebral palsy, which is terrible at the time, and tragic. But fortunately, they were able to get onto it early enough, and you don't see any effects on it now. But that story kind of struck with me through my professional career when I became a medical device engineer. And what I saw was the need for digital health and to help people understand what's normal and what's abnormal, particularly when they're going into new environments, such as bringing a new baby from home. And so, we're a little bit different in that we're a hardware company, so we use wearables. And what we see in healthcare at the moment, I don't need to talk to anyone here about the benefits of home healthcare. Everyone knows about that. But what we see the role of wearables in that aspect is being able to triage for nurses and help them understand help parents or patients understand where they're having issues so that they can go to a nurse and get help. Because we're just running out of money to keep employing nurses. As much as we'd like to have a nurse to every parent, we can't afford that. But at the same time, we can't remove the empathy and the care that nurses provide. So there's kind of going to be this hybrid form of care that we see in the future, using technology alongside nurses to deliver the value of care that we appreciate now. And so we think the role of wearables is really to drive patient-focused care, to be really easy to use and comfortable and integrated into patients' lives. So we decided to do something about it, and Goldilocks is our case study. So what we do is we integrate sensors into clothes, so super comfortable, super easy for the patient to use, integrated into their life. Everyone wears clothes. And what it does, if we go to the next slide, is we collect all the biometrics from these sensors and it goes to an app. And this app has kind of a neural network or machine learning behind it, which builds personalised insights into the baby's well-being. So we build up a picture of the baby and what the baby normally looks like. So we know their normal temperature ranges because they wear it all the time. We know what their breathing normally looks like. We know what their feeding looks like. We know what their sleep habits look like. And then we determine abnormalities. Then we can alert parents to that. But at the same time, we don't just alert, we then connect them with a clinician, and the clinician can then provide support and help right when they need it, not 6 months when you're pregnant and you're trying to cram for pregnancy, as it were. So we provide like really bite-sized bits of information right when they need it. And what we see the role of Goldilocks in that role is to reduce parental stress by providing reassurance that, hey, everything's okay, and also providing education that if things aren't okay, this is what you do when your baby has a high temperature. This is what you do when your baby has a breathing issue or something like that. We're also using these algorithms and wearables to improve infant safety and detect development issues as well, and allowing clinicians to have remote access as well, so that they can kind of keep an eye on their patients to detect deterioration and that type of thing. But what I'm kind of really excited about as well, and the role that I see of wearables, is being able to do early intervention and prevention as early as possible. So because we're tracking a patient 24/7 all the time, we know what's normal, we can get that early intervention and prevention as soon as possible. So at Goldilocks, we're building the largest data set of really highly qualitative data about babies, and we have that. We have a product on the market that we're selling, and our vision is that kind of all babies have this when they leave hospital, to keep them in the Goldilocks zone, safe, happy and well, or just right. That's our goal, and we're proud to be working alongside a lot of really amazing nurses to bring this technology to market. Thanks for your time. If you have any questions, feel free to reach out.
Fantastic, Shem. I just love that use case. And I'm a mother of 3, and I know the mistakes I made with the first and then the second, and then, you know, you sort of nearly quite got it right by the third, but he probably would say something else about that. But I think it is really an important part of parenting. And so this is really exciting. Thank you very much for being able to talk us through that, just that use of data and algorithms, and then the way that can be used for education and support. It's extraordinary.
No, thanks for having us on.
And please, if there's any questions, post them to us so that we can ask them at the end. So Alison's here. Alison Stokes is a founder of Beyond the Clinic. Ali was the founder of this startup company, which is Beyond the Clinic Remote, which provides new ways of monitoring patients. The technology provided by Beyond the Clinic gives health practitioners real-time insights into patient recovery outcomes. So Ali, I'm going to hand over to you, and I look forward to hearing about this.
Thank you, Naomi, and yeah, it's a pleasure to be here, and thank you everybody. So much like Shem, I am a health tech startup, and so it's really thrilling to be on this esteemed panel of just really understanding all the pieces of puzzles that brings digital health. And I think that was really one of the silver linings of COVID, was that the digital health revolution finally arrived in healthcare, and we've seen it in every other industry, in finance, in consumerism. Health is being so complex, it's taken us a while, but COVID was that little nudge into the right direction. So I'm a proud nurse, and I've always been in the perioperative space, so not so much in the community space, but absolutely realised that I'm one cog in a very big system. And I went, after nursing for many years, I've gone and done a couple of years in corporate, in the medical device world, and then came and was consulting and working with a group of orthopedic surgeons. As clinicians, we're usually very good clinicians, but atrocious kind of business people, and really don't understand our core problems. We sort of wipe over them a little bit. And one of those things that we identified in a group of 7 orthopedic surgeons, and we see 12,000 patients a year, was that we weren't doing patient care very well, pre and post patient care very well. And so we embarked at the early 2020 on developing a mobile app that essentially provides information and instructions pre and post surgery, and primarily in the joint space. And I think there's quite a bit in the market happening at the moment around this. But essentially we did it for our practice to solve our own needs. And we then built a bit of an advisory board around from community nurses to GPs to the anaesthetist, anyone that was going to involve and touch that patient that was going to have surgery, to really help us and guide us to say, well, what do we all want to know? These poor patients, they come in, they have a 15-minute consult, they consent for surgery, we give them some arbitrary paper pack that's not engaging or interactive, and then we send them on their way and say good luck with the recovery. And so we felt like there was a big gap in monitoring, and are these patients actually doing what we told them? Are they prepared for surgery? Are we going to get the best outcome for these patients? So our product is essentially a mobile patient app that provides the information instructions to the patients from the clinician, and then the clinical dashboard then tracks and monitors those patients but also helps them to make better clinical decision making. So it gives us the red flags to say, okay, how are you performing? Are you in pain? We can see you're not performing your exercises. We might need to amend or change your course of care. So we're at that stage. We're at MVP. We're about to put through 100 patients through our mobile app, and I think we sometimes as clinicians we get a little bit nervous when we're having a big disruption into our normal traditional pathway of care. But I think given that we are a limited workforce, we've got an aging population, huge demand on healthcare, I think digital health is nothing to shy away from, but to adopt. And to Sham's point earlier, really taking that hybrid approach to healthcare where we're using digital technology to augment our care so that we can provide better quality time when we're with our patients, because they feel empowered because they have all the information that they need in their hands. So that's Beyond the Clinic. We're very early stage. I'd love to keep you updated, and if you have any questions or want to reach out, please do. Thank you.
Thanks, Ali. I think what we're really, what I'm seeing here as the trend is particularly around how we empower patients and parents, to really feel that they can engage with us as nurses, but also with the broader health team, and also to really, participate in education and that sort of thing. So yeah, really extraordinary work, and I really look forward to hearing more. So you must let us know how you go.
Thank you.
Thank you. So Margaret is here. Margaret, welcome. Margaret Dempsey is the Project Officer and Primary Health Consultant for the Australian Primary Health Care Nurses Association, which is APNA. So Margaret's an experienced registered nurse with extensive background in emergency and primary health care nursing, including clinical, educational, administration and facilitation roles. Margaret passionately advocates to strengthen the role and utilisation of primary healthcare nurses to foster improvements. And Margaret, I think you might bring it home for us after our really diverse range of speakers tonight, so I look forward to hearing from you.
It's been a fabulous group. I've enjoyed it as well. So thank you very much, Naomi. And I am pleased to be joining you this afternoon from Wadawurrung country in Victoria. A little bit about APNA. It's the Peak Professional Membership Association for all nurses working outside of a hospital setting in Australia. And that includes settings like general practice, aged care facilities, Aboriginal community controlled health organisations, nurses working in schools, community health or correctional health settings. And we know that nurses working in primary health care play a vital role in keeping Australians healthy. Their roles are diverse, and more than ever before, nurses are shouldering an enormous workload, I don't need to tell anyone that, under difficult conditions. As we dealt with the pressures of the global pandemic last year, but now as they're facing the challenges of the vaccination rollout process, as well as managing business as usual, that hasn't really stopped. So we know that nurses are adaptable, and they have indeed adapted to those changes that are required to continue to provide quality health care. And many of those changes have literally had to happen overnight. And so we've seen how digital health technologies have enhanced working environments for nurses and indeed the primary health care team. So on the next slide, APNA recognises that nurses are well placed to lead the implementation and education about the use of digital health technologies to their patients and as well as to their colleagues. Nurses play key roles in implementing digital health technologies, which educates and empowers patients to be involved in their care. That's exactly what you just said, Naomi. So it was a great segue into what I was going to speak about. And also nurses play a key role in providing education to colleagues, so to GPs, other health professionals, and also to non-clinical practice staff. Jenny from the Australian Digital Health Agency started tonight's session and spoke about digital health technologies, which include My Health Record System, electronic prescribing, telehealth consultations, which could be video or phone consultations, and also secure messaging systems, which is sending secure exchange of clinical information between healthcare providers. And I'd like to mention 4 key APNA initiatives that support nurses to implement those technologies into routine practice. APNA's Nurse Transformers project is designed to boost the digital literacy of our nursing workforce, as nurses play a critical role in team-based coordinated care and are often the key point of that continuity of patients who see multiple health practitioners. The Nurse Transformers project involves recruiting and training nurses to be digital champions that spread their knowledge of digital health tools and technologies to others. And initially, our program was designed to champion nurses teaching other nurses. However, we found that much of the time, the nurse transformers were also educating doctors and educating the non-clinical practice staff. And that's not really surprising, is it? Nurses, education is a core role for nurses, and they do it so well. And as such, the nurse transformers also spend a significant portion of their time educating patients, of course, about digital initiatives like My Health Record through the course of delivering care and discussing immunisations, perhaps during aged care health assessments. They might have been discussing how patients can upload their own advanced care directives to My Health Record. So the nurse transformers told us that the time spent discussing these aspects of digital health with patients had become an increasingly prominent feature of their role. APNA also runs a Nurse Digest webinar series, which is delivered in collaboration with the Australian Digital Health Agency. They're monthly webinars which explore useful digital technologies designed to enhance daily practice. Each session is recorded and is available to view at any time through APNA's website. Topics that we've looked at in the past have focused on the use of My Health Record, so viewing somebody's record, the nurse's role in uploading shared health summaries, the value of electronic prescriptions, and the role of viewing immunisation records in My Health Record. And that's, of course, quite topical at the moment if there's a need to provide evidence of your COVID vaccination status. So building on the premise that nurses love to learn from each other, and I think we'd all agree with that, APNA has established a digital health community of practice, which is an online platform that provides an environment for nurses to share learnings and experiences relating to the use of digital health systems. And you don't need to be an APNA member to join that. And APNA also has a suite of online learning modules. Interestingly, the module titled My Health Record, Taking Your Patient Care to the Next Level, is aimed to develop confidence of primary healthcare nurses in the use of the My Health Record system. And so the next slide, I just wanted to show it because this is taken from our APNA National Survey, the workforce results. And these results complement these findings from the Nurse Transformers project about the roles that nurses play in educating colleagues and patients about digital health enhancements. And the findings show that nurses learn about these new technologies, one, as they are introduced in the clinical setting, two, they learn from their peers, and online training courses made up the top three options. And in closing, on the next slide, I just wanted to share some quotes with you. One was from a general practitioner that said electronic scripts have been a game changer in general practice. And the term game changer isn't really used lightly. So the introduction of electronic prescriptions is so valuable as it improves medication safety. And it makes it so easy for patients that don't have to be, especially in a COVID world, and if we're in a particular hotspots area, they can have telehealth consultation, they can have an electronic script sent to them at the time onto their phone, and they can also tap into a pharmacy's, the app that they use, and actually send that information direct to the pharmacy to have their script. There's options they can even pay for it at the time as well. And in some areas, they may actually have the pharmacy may have a delivery service. So the patient can do all of these things from their own home, which is absolutely perfect in rural, regional areas, most definitely. So the next quote is part of an email that was sent to one of our nurse transformers. Keep on to the same slide, thank you. It was sent to the nurse transformer from a nurse working at a nearby general practice. And that nurse said, I just wanted to pass on sincere thanks to your nursing team for doing My Health Record uploads. I've seen several mutual patients and it's been an enormous help being able to access their medical histories for their care. Very grateful. That nurse transformer did tell me, and literally she said, I did a happy dance around the treatment room when I received that information. She said, it illustrates what we all know to be true, having an up-to-date comprehensive digital health record equals connected care, which in turn leads to better patient outcomes. And that's lovely. And I thought I'd finish up on that because really that's what it's all about, isn't it? Better patient outcomes, connected care, and building healthier communities. So thank you.
Thanks, Margaret. Thanks for that presentation. And you know, you've touched on so many important aspects there around the important role that our community nurses and primary health nurses play across Australia. So thank you very much. So I do have a couple of questions that I just want to put out to the group. And thank you, people who have put these forward. So the first one, and I think I'm going to pick on Shireen initially, but I'm very happy for someone else to pick up on this as well, is why is the role of a nurse so important in virtual health while other digital platforms are actively moving towards artificial intelligence or AI?
Yeah, so virtual health continues to offer so much potential in terms of career opportunities for nurses. For example, at Medibank, nurses play a vital role in providing that reassurance that callers are seeking by using their clinical skills and expertise. People who call our service are looking for that peace of mind that can be provided by a registered nurse who has that warm and trusted touch over the phone or even via web chat. So the value of having a registered nurse is the ability to assess a patient using only their sense of hearing in order to assess the full clinical picture of a patient. And then imagine the additional challenge of completing that assessment via web chat. So, you know, when we have an RN who can use that clinical autonomy and the sharp interpretation skills, they'd be able to read between the lines in order to deliver the safest and most appropriate clinical advice and direction. And this is, you know, a great characteristic of a nurse, and it can't be substituted by artificial intelligence alone. I touched on telehealth nurses mainly because that's, you know, my focus area. But we've also been providing, you know, the delivery of home care and hospital in the home programs. So in addition to nurse triage, the health coaching and support, we've also, you know, been providing cardiac rehab, chemo, dialysis, palliative care in the home, hospital in the home services for like treatments such as cellulitis, kidney and urinary tract infections, pneumonia, pulmonary emboli, chronic heart failure, infections requiring intravenous antibiotics, such as some conditions like mastitis. So there's so many different ways that the human touch of a registered nurse makes a huge difference and cannot be, you know, substituted by pure artificial intelligence. I do acknowledge the importance and how it's advancing healthcare by leaps and bounds, but having that human touch will always continue to bring that value right home to the people seeking that healthcare.
Thanks, Shireen. And I know it was a Dorothy Dix question, but I think it's really important that we do position this conversation in the requirement to still provide our nursing care, and you know, that's what really makes it so important. Does anyone else have any comments they wanted to make there?
I'd just like to comment, Shireen, you mentioned about the registered nurse, the touch, the emotion is still really important. It's interesting because throughout the COVID pandemic now, we're hearing of a term that we've never heard before called touch hunger. So that's the new issue, because we can't have handshakes and we can't hug, and in some areas into aged care facilities, you know, we can't hug our loved ones. And so this new terminology of touch hunger we'll perhaps see and hear more of that. So I thought that was interesting to follow up with your comment.
Thanks so much. It is, yeah, absolutely correct for those of us that live in Victoria, and I'm one of them, a Melburnian. We've had a lot of time, you know, in lockdowns, and appropriately so, but it has been really difficult for a lot of people because of that. So we do have a question for Shem. Goldilocks, what age are the products designed for? I gather newborn, but up to what age?
Yeah, so newborn was our case study, and typically we don't see parents, well, we don't see babies use it beyond 18 months because by then they can kind of communicate fairly well with the parent. The parent can understand them. In saying that, we are working with ECH to make something for aged care. So whilst we talk a lot about the baby product, and that is the baby product, we also have lots of other avenues that we're working in. We're working in aged care, but we see avenues in disability, rehab, prohab as well for this kind of technology as well. But babies is kind of what I know and what I was experienced in. So, and that's if you can help the development of an infant as well, the impact of that is enormous as well, potentially greater than the impact in aged care or something like that.
Fantastic, thank you. We also have a question for Alison. It says, hi Alison, you spoke of orthopaedic patients. Does your Beyond clinic include patients who have other surgeries?
Yeah, that's great. Thanks for the question. And yeah, so orthopedics is our test case because that's my business partner is an orthopedic surgeon, and it's easy to sort of put patients through. And but we've realised that our problem is not unique to us. It's actually a problem that's across multiple surgical specialties. So and we are just carefully crafting our steering committees with clinician-based steering committees to help us guide and develop some protocols so that we can expand into general surgery, plastic, obstetrics, and other surgical specialties that will find benefit out of care beyond the clinic. Yeah, thank you.
Fantastic. Ruth's on. Hi, Ruth. Lovely to see you. Ruth D'Souza, I'm sure everyone has to know Ruth D'Souza. She's amazing. Anyway, she has a question for Shem, a follow-up question. Might this surveillance contribute to increased parental anxiety? Then she's got in brackets, I appreciate this includes clinical support. And then she says, amazing work. Shem, what do you think about that one?
Yeah, really, really common question from nursing, particularly any nurses in ED. The last thing they want is a parent coming to them saying, my baby's normally 37.3 degrees and now they're 37.4, So we worked a lot with nurses initially to work out how we can provide enough detail to parents without providing too much and creating greater anxiety and stress, because what we're actually targeting is parental stress. That's actually what we're targeting. So by us creating more is going against what we're trying to do. So essentially the way we do it and the way I've seen other healthcare systems use is we use a traffic light system. So we don't say, hey, your baby's 37.3 degrees or 37.4 degrees. We say, hey, your baby's in the green zone. No need to worry, move along, like that type of thing. And then they're in the orange zone, and then, hey, they're in the red zone. Here's a video from our clinician talking about what to do when your baby's in that. For instance, if they have a high temperature, it talks about, have you tried a wet flannel? What clothes are they wearing? How hot is the room? All the way down to, have you tried some Panadol? Go and talk to your midwife if it persists type thing. To really try and not only reduce the kind of questions and anxieties that I have, but try and resolve it as much as we can as well. So, but thanks for that question. It's a really, really good question and one we spent a lot of time thinking about at the start.
Yeah, fantastic. Thank you. Well, it's 5:59 and I just can't believe it. That's been the fastest hour of my life. Can I just thank each and every one of you for your extraordinary presentations and contribution this evening. It's been amazing to talk about the breadth of digital health in nursing in the community, but also, we've touched on a lot of other things about empowering our patients and really, what it is that nurses bring that AI can't. So what an exciting evening. We would like to, again, of course, thank our sponsors, Regal, Medibank, APNA and Smith & Nephew. As you know, we can't bring these sorts of events to you without them. So thank you again. Everyone have a lovely evening and we look forward to our next webinar next week. See you then.